Did you know there are more than 20 million people living with diabetes in the United States? It is important, once a patient has been diagnosed with diabetes, that the condition is managed to prevent diabetic complications from developing. Type 1 and Type 2 are the two major types of diabetes. People with Type 1 diabetes are generally diagnosed when they are children or adolescents. Type 1 diabetes is when the insulin-producing cells in the pancreas are destroyed. Since Type 1 diabetes patients do not produce insulin, they need to give themselves doses of insulin daily. The majority of people with diabetes have Type 2.
The second and much more common type is Type 2 diabetes, which is a combination of poor insulin response in the body in addition to the inability of the cell in the pancreas to produce enough insulin to overcome that problem. So we call that insulin resistance.
There are several ways people with diabetes can manage their condition. They can do this by monitoring their blood sugar, eating healthy meals and losing weight if necessary, exercising regularly, taking appropriate medications to control diabetes, high blood pressure, and high cholesterol, and by getting proper medical attention. Regular exercise is especially important in controlling diabetes.
Now, the reason physical activity is part of the prescription is because not only does it help with weight loss, but physical activity itself sensitizes the body to insulin. So it means that the stress on the pancreas to make more insulin is relieved and reduced.
It is essential that people with diabetes monitor their blood sugar on a regular basis. Testing the blood glucose allows diabetes patients to see how food, exercise, and medicine are affecting their blood glucose level. Normal blood glucose levels before meals should be between 90 to 130. 2 hours after a meal, blood glucose levels should be less than 180. Vernon Wagner, a diabetes patient, knows it is crucial to monitor his blood glucose levels on a regular basis.
It's really important. It's the most important thing you can do, is keep checking it and keep it down.
It may be helpful for diabetes patients to remember their ABCs as they work to manage their condition. A is for the A1C, a test that shows the patient's blood glucose levels over the last 3 months. Patients should take this test a minimum of twice a year, and their goal is to have an A1C number that is less than 7. The B stands for blood pressure. Patients should keep their blood pressure around 130/80 or less. C stands for cholesterol. Patients should keep their LDL cholesterol at less than 100. When people with diabetes manage their disease, their chances of developing complications decrease.
I think today people with diabetes should never develop disabling complications. You know, they may develop a little issue here, a little issue there, but as far as going blind, having an amputation, ending up on dialysis, it just really shouldn't happen anymore.
If people with diabetes would keep their blood sugar levels within the normal range and look out for any potential complications and stay in close contact with their healthcare providers, they should be able to manage their disease and live a healthy life.